These estimates show in no uncertain terms that you would be having a larger total sum of funds devoted to medical care in Great Britain today if you did not have a state system of the provision of medicine. In addition to the fact that the ultimate result of a government takeover is less resources, you invariably get lower quality and a lower quantity of medical care. The experience of the United Kingdom is again clear. I'm going to cite from a study that was made by a British physician, Dr. He wrote a report in December 1976 on the public provision for medical care in Great Britain, and I quote, "National Health Service brought centralized state financing and control of delivery to virtually all medical services in the country. The voluntary system of financing and delivery of medical care, which had been developed in Britain over the preceding 200 years, was almost entirely eliminated. The existing compulsory system was reorganized and made practically universal. No new hospitals were, in fact, built in Britain during the first 13 years of the National Health Service. And there are now, in 1976, fewer hospital beds in Britain than in July 1948 when the National Health Service took over. And I might add, of the hospital beds which there are now in Britain, 2/3 are in hospitals that were built before 1900 by private medicine and by private activity." He argued that whenever you have any organization taken over by a bureaucracy like a government, what tends to happen is that input goes up and output goes down, that useless work tends to displace useful work in a further extension of Parkinson's laws. And he illustrated it with hospital service in the United Kingdom. He took the 8-year period from 1965 to 1973. In that 8-year period, the hospital staff, the number of people, went up 28%. Incidentally, administrative and clerical help went up 41%. But what about output? What about what they were producing? It turned out that the average number of beds occupied daily went down by 11%. And he hastened to go on to explain that the decline in the average number of beds occupied was not for want of patients, that at all times there was a waiting list in the neighborhood of 600,000 people waiting for hospital beds. I don't know how many of you know the scandals in Britain about the waiting periods for what is regarded as optional or postponable surgery, including, for example, bypass operations for heart problems.